Hello, this video lecture addresses renal calculi. So renal calculi are also known as urinary calculi, or they're more commonly called kidney stones. In the medical field, you will most commonly hear them called renal calculi or urinary calculi, and then the general population typically refers to them as kidney stones. It's all the same thing. So renal calculi are caused by the development of one or more crystals ranging in size from very small to large enough to fill the renal calyces. And the renal calyces are chambers within the kidney that urine passes through. The calyces surround the apex of the kidneys. So renal calculi can lodge anywhere in the urinary tract, and they can also cause obstruction and kidney damage. So if they lodge somewhere in the urinary tract, like the ureter, then that can, and often does, result in the obstruction of urine flow, and so then that urine kind of backs up into the urinary system and into the kidneys, and it causes a lot of problems. So kidney stones are very painful. Most clients who have had a kidney stone will describe it as excruciating pain or the most painful experience that they've ever had in their life. And that excruciating pain occurs when these crystals that are multifaceted. So when I think of that, I think they have all these like jagged edges on them. Those crystals scrape along the lining of the ureter as the stone is trying to pass out of the urinary tract. And that causes a lot of irritation, and it can cause spasming of the ureter. So that is very painful. Lithiasis is another word for a stone formation, and a stone would really be like a small hard deposit. Nephrolithiasis is stone formation that occurs within the kidney, and then urolithiasis is stone formation that occurs elsewhere in the urinary tract. So for example, the bladder. Okay, so this image really kind of depicts the urinary tract and really how stones would need to move out of the urinary tract and into and out of the body, basically. So, you can see several stones here. There's several within the kidney, these little things. And, this stone right here is blocking the flow of urine. So you can tell all this up here, the ureter is enlarged, and it's causing urine to back up and cause some problems in the urinary tract. And then there's also stones in the bladder, as you can see these things that are trying to move out of the body. The urethra is that tube that essentially goes from the bladder to outside of the body. So for a stone to travel out, so let's say there was a stone in this kidney. If a stone forms in the kidney, it would travel out by going through, down to the bladder, and then out. So, but sometimes the stones get stuck on the way, and that's a kind of a problem. Okay, so when the concentration of an insoluble salt in the urine is very high, so otherwise when the urine is like very super saturated, then that's when these crystals can form. And these crystals usually disperse and are eliminated because the bonds holding them together are weak. So that would be in a normal functioning urinary system. But if that's not happening and the urine is super saturated, then they kind of stick together and they form these crystals or stones. So then a nucleus of crystals may develop stable bonds, like I said, to form the stone. So factors that can lead to stone formation include eating foods that are high in insoluble salt, decreased fluid intake, abnormally acidic or alkaline urine, and then the absence of calculus inhibiting compounds that are normally found within the urine. There's more information about that in your book, so please go there to further review. Okay, so there are different types of renal calculi, 4 different types that are all listed on the slide, so let's talk about those. So first of all, the most common type of renal calculi are composed of calcium oxalate and or calcium phosphate. Those types of stones are generally associated with a high concentration of calcium in the blood or urine. And then there are uric acid stones, and those develop when the urine concentration of uric acid is high. They are more common in men and may also be associated with gout. And then there are struvite stones, and they're also called staghorn stones. That's just another name for that type of stone. That type of stone is associated with urinary tract infections that are caused by ureus producing bacteria such as Proteus. So those stones can become very large and they fill the renal pelvis and calyces. And then cystine stones are very rare, and they are typically associated with a genetic defect. Okay, so this slide just has an image of the different types of kidney stones and what you would expect those to look like. And then here is a cross section of a kidney that has a large struvite stone in it. And remember, that's the one that's caused by urinary tract infections. And so the actual stone within this, I'm going to outline it so that you can see what I'm talking about. The stone is right here. All of this. And it looks like there might be it might be a stone as well. So that is what they mean when they say that a struvite stone can literally, kind of fill the whole kidney. And so you can think about how that affects kidney function and ultimately leads, greatly decreases the kidney's ability to function in that situation. A stone that large, realistically, the patient would need to have surgical removal of that stone. Okay, so how do you assess a client with a kidney stone? So you want to get a health history, and you're going to address all these things here. So history of current illness, tell me about your symptoms. When did they start? Have you had this in the past? Get the history of their current illness. You want to know all of their urinary symptoms, including pain and any other symptoms. If they have any, so when I say other symptoms, so they can have other symptoms that aren't really urinary in nature. So maybe I have a kidney stone and my pain is so bad that I'm feeling nauseated, or that I'm dizzy and I feel like I'm going to pass out because of how painful it is. Also, to talk with them about precipitating factors. So, what were they doing before they experienced the pain, and when the pain started. History of renal calculi. Have they had this in the past? Any, what is their diet like? What medications do they take? And then fluid intake is important to discuss as well. And then your physical examination includes a general appearance exam. You definitely want to get vital signs. You're going to assess their abdomen, and specifically GI and GU, so the gastrointestinal, genitourinary. You also want to know what their urine looks like. Does it have a foul odor? And then any CVA tenderness, and also their skin color and temperature. So risk factors. So one would be if they have a personal history or family history of previous kidney stones. Dehydration is a risk factor because that causes increased urine concentration and decreased urine flow. So we already talked about how kidney stones form in a more concentrated urine, but also another issue is if urine is stagnant or not moving through their urinary tract, then that increases the risk of stone formation. Diet, excess dietary intake of calcium, oxalate, or protein increases their risk of stones. Gout, a history of gout can increase their risk. Also a history of hyperparathyroidism. And then we talked about urinary stasis. That would be if they're not really drinking adequately and moving urine through, or if they're holding their urine. That increases the risk of stone formation. History of repeat urinary tract infections is a risk factor. And then also immobility, because that leads to a loss of calcium from the bones, and then that increased calcium in the blood and urine can cause increased stone formation. Renal calculi are 1 to 2 times more common in men than women. Okay, so clinical manifestations. The symptoms really vary depending upon the size and the location of the stone, or they could have more than one stone, which would obviously cause increased symptomology and increased pain. Stones that are located within the kidney or bladder are typically not painful and cause very few symptoms. It's when the stones are moving through either the ureter, which that's the tube that connects the kidney to the bladder, or the urethra, which is the tube that takes the urine from the bladder to out of the body. So then symptoms occur as the stone moves through. It's typically the ureter is the most painful. And then definitely know what renal colic is. That is acute severe flank pain on the affected side of where the stone is that develops when urine flow is obstructed by the stone and the ureter then starts spasming. It's very painful. Patients don't do well with experiencing renal colic. And then the pain can radiate into those areas listed there. They can also have some vital sign changes like tachycardia, tachypnea, hypertension, and then they can experience all of those other symptoms listed there, including some of those urinary symptoms. Because realistically, if a client has a kidney stone and it's scraping along the inside wall of their ureter, that's probably causing some opening in the integrity of the wall of their ureter. And anytime there's an opening there in the urinary tract, that increases the risk of infection. So they're high risk for UTI. So definitely if they have UTI symptoms, you want to know about that because the UTI would need to be treated. All right, so diagnostics. A urinalysis is a priority diagnostic. And if a client has a renal calculus, you're expecting that in the UA, the urinalysis, the red blood cell count is going to be elevated because we already talked about it scraping alongside the wall of the ureter. So there's going to be some bleeding, most likely. You may not necessarily be able to visibly see blood in the urinalysis or in the urine, but upon microscopic examination, they might find increased red blood cells. Elevated white blood cells would be present if there is an infection, like a urinary tract infection. They could have elevated or low pH of their urine depending upon the type of stone. So acidic and alkaline urine both increase the risk of stone formation. Other diagnostics is that a stone analysis would want to be done. You'd want to do that. The provider would probably order that to see what type of kidney stone it is, because then once you know that, you're going to be able to educate the patient about diet changes that would need to be implemented. To analyze the stone, you'd have to instruct the client to strain his or her urine with a kidney stone strainer. And then once the client gets the stone, they would put it in a specimen container and take it to the lab for analysis. So then the actual analysis can take, several days. So realistically, the stone analysis results won't be back, right as the patient's presenting to an urgent care or emergency department. Urine calcium and uric acid levels, as well as oxalate levels, are appropriate to analyze, why these stones are forming, as well as serum calcium, phosphorus, and uric acid levels. A KUB is an x-ray of the kidney, ureters, and bladder, and that you would likely be able to see kidney stones on that. A slightly more detailed exam than that would be a renal ultrasound, where they use sound waves to try to see if there are any stones present. CT scan can also detect stones. An IVP is really a test where they start an IV, inject dye into the veins, and then they get some radiologic images to see if they can see kidney stones on those images with the increased, with the dye. It would be a more specific exam. And then a cystoscopy, that's where they put a scope into the ureter and up into the bladder. I'm sorry, the scope goes into the urethra, into the bladder, and then up into the ureter and kidneys to see if there are stones. They can even remove stones with a cystoscopy. So that's a surgical procedure. And that would increase someone's risk for infection because, they're introducing a foreign object into the urinary tract. So what are we going to do for these patients? Managing their pain and other symptoms is really important. So as I've mentioned, this is very painful. So helping to get their pain under control is a priority, and you're most likely going to also give something for nausea and vomiting, because a lot of times they are already nauseated and or vomiting because of the increased pain. And if they're not already nauseated, the pain medication that you give them can certainly cause some nausea and vomiting as a side effect. Most pain medications have that as a side effect. Removing or destroying stones is an option. So, realistically, lots of patients are going to pass this stone on their own. That would be the preferred method, because to remove or destroy the stone would be an invasive procedure that increases their risk of infection and other complications. So, telling them to increase their fluid intake, drink a lot of water, helps to flush out the urinary tract and helps them to pass the stone. Preventing further stone formation is important because, I'm sure they don't want to have another kidney stone. So dietary modification might be necessary to help them prevent further stone formation. Preventing infection is important. We've talked about how they're increased risk for infection. And then monitoring their intake and output is also a priority. So some of these procedures that can be used to remove the stones if the patient is not able to pass it on his or her own. So a lithotripsy uses sound or shock waves to crush a stone. It's the preferred treatment for renal calculi. And then there are a couple different techniques that are considered a lithotripsy. There's the extracorporeal shockwave lithotripsy, and that's a non-invasive technique for fragmenting kidney stones by using shock waves generated outside of the body. So that would be, minimally invasive to the client. And then a laser lithotripsy is where laser beams are used to disintegrate the stone without damaging soft tissue. And this procedure does involve passing a scope up into the urinary tract to the location of the stone. So this is an invasive procedure. So then there's a, hang in there with me with these words, a ureterolithotomy. And that's where an incision is made in the affected ureter to remove the stone. The pyelolithotomy is where an incision is made into the kidney pelvis to remove a stone. And then a nephrolithotomy is where this would really be for those staghorn stones that is filling the calyces and renal parenchyma, and that is where those would be removed from within the kidney. Okay, so medications, what are you going to give them? So I'd say the most common pain medication that they're going to receive would be an opioid analgesic, most likely morphine sulfate. That binds to opiate receptors in the central nervous system, and it therefore decreases the severity of pain. It can cause sedation, confusion, hypotension, respiratory depression, and constipation. So you really want to assess your patient frequently if you give them this, and assess their vital signs frequently. This IV route is a preferred route of administration of morphine sulfate for patients with renal calculi. Another medication that can also help reduce their pain, and it's ultimately going to help reduce their inflammation, is ketorolac, or otherwise the trade name is Toradol, and it's an NSAID. It inhibits prostaglandin synthesis and produces analgesia. So it also is for pain relieving properties. It has antipyretic and anti-inflammatory properties. So it decreases inflammation, and it can also decrease fever to a more normal temperature. It decreases the severity of pain, and it can also cause some drowsiness. IV route is preferred for patients with renal calculi, and this med should not be used for more than 5 consecutive days. Also just know that thiazide diuretics may be used to help patients to pass calcium stones, and potassium citrate helps to alkalize urine, so that might be administered for uric acid stones, cysteine stones, and some calcium stones. Okay, so complications. So obstruction of urine flow, we talked about that. So if the stone gets kind of caught in an area, it's most commonly occurs in a ureter, then their urine flow is going to be obstructed. So in this situation, you definitely want to monitor their I&O, frequently assess your client, increase oral and IV fluid intake, and they are going to be a possible surgical candidate to have the stone removed if it's lodged and they can't pass it on their own. So then there's hydronephrosis, and that is accumulation of urine in the renal pelvis as a result of obstructed urine flow. So that's really that previous picture, that diagram where I showed you that the ureter was really dilated above where the stone was lodged. Also, the kidney can become enlarged, and that is called hydronephrosis due to this kind of backup of urine. This can be acute or chronic, and this really surgical removal of the stone is almost always needed in this situation. You're definitely wanting to monitor I&O here and assess your client frequently. Infection can occur. We talked about that. So you need to assess for signs of infection, monitor their labs. The white blood cell count is specifically something that you're monitoring here. It would be elevated in the presence of infection. And then you want to educate your client. Pain is a complication. So, it's important to frequently assess pain and to use pharmacologic and non-pharmacologic pain management techniques. And then damage to urinary tract structures can happen. So, we talked about if a stone is lodged, how, urine can kind of backflow and that can damage urinary tract structures. So just frequently assessing your client is important. And then some diagnostic testing might need to occur there, such as, radiologic exams and imaging to assess those structures of the urinary tract. So what client education are you going to provide? You're going to tell your client to increase fluid intake. So they want to drink at least 2 liters of water daily because, they really want to flush out the urinary tract to promote passage of these stones. They need to remain active. We talked about how immobility, just further increases stone formation. If they're on any medications, you want to educate them about that. And then specifically if they're on pain medications, how do they manage their pain with that? And then how also can they manage their pain with techniques that do not require medications? Monitoring their urine output and characteristics will be important. So if they stop having urine output, that would obviously be very concerning, and you would need to instruct them to seek immediate medical attention. You're going to tell them how to strain their urine for stones. We talked about that earlier. Every time they urinate, they'd be straining it for stones. And then take medications as directed, as I said earlier. You'll tell them the symptoms of a urinary tract infection and that if they have any of those to contact their healthcare provider immediately. You're going to discuss dietary changes, and that depends on the type of stone. So for calcium stones, they're going to want to reduce sodium and animal protein in their diet, limit foods high in calcium and oxalate, and increase foods that acidify urine. Struvite stones, realistically, antibiotic therapy is going to be required because those are associated with urinary tract infection. Uric acid stones, they need to limit their intake of animal proteins, and they're going to follow a low purine diet. And then cystine stones, they're going to limit sodium intake. And that is the end of this renal calculi lecture video. So thank you for watching.